Filming? Robin here with LVJ Sports Medicine. Today we're talking about splints. So the basic splint for a non-deformed arm fracture that we're going to use here is a SAM splint. Now these are long, pliable splints that can be x-rayed through, and we're going to apply them before we transport the patient to the hospital. So let's say Adriana here has a non-displaced fracture, or at least we're pretty sure it's a fracture, in her arm. So there's a few ways we can splint it. We can take the splint and we can go around the arm. Now I would mold it on myself usually, but not for this demonstration. Because really you'd want to mold it on someone else before putting it on the injured patient. So we can put it around her arm like this, and then take some stretchy tape or some any sort of wrap and kind of enclose this up, and then that'll keep the fracture immobilized. Or what we can do, we can fold it and give it a little bit of a curve for extra strength, and then it kind of just goes in your arm like that. And so with any fracture, what you want to do is immobilize the joint above and the joint below. So if it was right here, you want to immobilize the wrist and the elbow. If we had a fracture in her leg, she'd want to immobilize, well, if it was in the lower leg, like right here, you'd immobilize the ankle and the knee. So moving on, we're going to use a larger splint to immobilize a humeral fracture. So for that, we're going to use a large vacuum splint. Go ahead and put your arm like this and stuff that. We're going to throw this on. I'm just kind of going to go around it. And then we're going to use extender straps, which are in the bag. So you can stop this here. So, splints continued. Here's what we're gonna do if we have a tib-fib fracture, approximately right here. We're gonna need a couple people to help put this splint on. So first, the most experienced trainer is gonna isolate the fracture and make sure that nothing else is gonna move around. And then, so I'll hold this, and Kayla, would you please go get the splint? So I'm making sure there's no more movement in the fracture. Then we're going to get the splint in place. And then we're going to lift up and we're going to slide it under. And like I said before, we're trying to isolate the joint above and the joint below. So that's going to be the ankle and the hip. The knee, here, because they're tib-fib. So then we're gonna Velcro up the splint, and we're gonna do it most of the way down, but we're gonna leave the toes. We're gonna leave the toes exposed. So if she didn't have any socks on, we could make sure there was still blood flow down there. So then we're gonna take the pump. And we're going to suck the air out of the vacuum splint, which is going to make it really, really hard. Alright, so at this point, the patient is ready to go to the hospital. And this can be x-rayed through. It's translucent. And you're gonna have to make sure you get it back too, because they're pretty expensive. But yeah, you send the patient off to the hospital. So that's about it with splints. Thank you for watching.